Of potential risks of a popular skincare treatment. It's called radiofrequency microneedling.
The FDA says it can cause serious complications, including burns, disfigurement, maybe even nerve damage. So here to answer some questions, and we'll get into it a little bit, Dr. Abby Waldman with Mass General Brigham. Doctor, it's always great to see you. Thank you. I just read a pretty scary list about some things that could happen. Some of us have never heard of RF microneedling. Could you tell us what it is and why would anyone get it?
It is a popular procedure done for lifting the skin and for reversing some of the signs of aging, like wrinkles. It is a combination of two procedures that have been around for quite a while. And one is microneedling, which puts tiny little holes in the skin. And the other is radiofrequency, which puts energy deep in the tissue. So you can imagine, just like a facelift, it is possible to have complications whenever you're working deep in the tissue. That being said, most of the time with the right operator, people have quite good outcomes, but like anything, there's always risks, and these risks are real that the FDA is bringing up.
Right. So be careful where you're getting it. Do you have, I'm assuming you have patients who have done this, right?
Yeah, it's a very popular procedure. I have lots of patients who have had this procedure. I even have friends and family members who have, and most are quite happy with their results. But I've also seen some of these complications, including scarring, nerve damage. It is possible also to have some fat loss when you're working deep in the tissue. So the key thing is really knowing who is doing your procedure, someone who has lots of experience, ask them their credentials, how many they have done. All of these things are key when you are considering getting radiofrequency microneedling.
So you bring up all of that. Let's balance it. If someone asks you about the risks and the benefits, what do you tell them?
You know, obviously it's a optional procedure, right? It's to lift the skin, to reverse some of the signs of aging. So you really just have to balance the risks and benefits. How important is that to you versus the potential risk of, having permanent nerve damage, any sort of fatty change, scarring. All those are potential risks. They're rare, but they are possible. So I think it's just, again, it's really dependent on the person weighing their risks and benefits. But just knowing, just like anything, like a facelift or any sort of procedure, it's a medical procedure, and there are real risks and benefits, and each person has to figure out what's important for them.
That's for sure, and you know that better than anybody because you're a doctor. I want you to tell everybody what your Instagram is, because you give out so much incredible, important advice in a very simple, clear way to sunscreen and all of those things. Tell everybody what it is. It's worth a follow.
Sure, thank you for that. It's Abby.Waldman, MD.
I know, I just put you on the spot. Just search you. You're in there, and you're terrific. And your
Abby
skin
Waldman,
looks...
MD.
There it is, and you look amazing.
ABBY, right? ABBY,
yes.
right. Very good, Doctor.
Exactly.
Thank you,
Great to see you.
Doctor.
Thank you. Take care.
Thank you.
So.